So welcome again. My name's Carol Benedetti. I work at the Aurelia Area CDC, and the CDC is also represented by our General Manager, Wendy, on the Ask an Expert Planning Committee. A couple of people behind the scenes that are offering some help. Wendy, thank you, and also Hannah from Simcoe County. The Planning Committee and the Ask an Expert series is led by the County of Simcoe, formerly Johanna Griggs, and now Hannah Conroy. Thanks to their leadership, we are able to bring organizations throughout the county some excellent content as you navigate the current environment. There are going to be future webinars, so I encourage you to keep your eyes out for that. And I would also like to thank our regional partners who've assisted with these webinars. That includes, of course, the County of Simcoe, but also the Small Business Center of Barrie, Simcoe County and Aurelia, South Georgian Bay Small Business Enterprise Center, of course, ourselves, the Aurelia CDC, Nottawasaga Futures, the North Simcoe Community Futures Development Corporation, and the Center for Business and Economic Development. Prior to today, many of you shared questions in advance, and we have provided our experts with these questions so that many of them will be incorporated into their presentations. If you do have a question that you think about the time and you want to put it in chat, we're going to be monitoring the chat as well to pass those questions on. And as time allows, we will have as much time for Q&A at the end that we can. If there are questions that we don't have time to address, we can always follow up, of course. So without any further ado, I would like to introduce our guest expert. I feel really fortunate to have the opportunity to facilitate today's session. This is an important topic as we all continue to navigate the ever-evolving COVID-19 challenges in a safe, responsible, and informed way. We have two excellent experts with us today to share on COVID-19 workplace and business safety. Kelly Magnuson will be our main presenter. She is the manager of Emergency Management Program, and also Martin Kuhn, who is a program supervisor for Smoke-Free, the Smoke-Free program, both experts from Simcoe, Muskoka District Health Unit. So I would like to introduce Kelly, and if we want to start recording, we are recording.
Thank you, Carol. Can I share my screen now?
Yep.
Okay, I just want to make sure that everybody can see my video, okay?
Yes.
Okay, thank you. Okay, so I'm just, thank you everyone for joining us today. This business information session, we're hoping to help businesses operate safely in the midst of the COVID-19 outbreak. In this presentation, I will be providing a little bit of information in terms of some of the public health measures and requirements that are needed in order to operate safely within your workplace. And I will be sharing some of the best practices to promote both customer and employee safety. As Carol mentioned, I have incorporated the questions into the slide deck, and we will have additional time available at the end of the session today in order to try to answer some of those other questions that are coming in. And with me, I have Martin Kuhn, who's joining me, and he is one of our key enforcement leads. So he's played a very significant role in terms of helping to interpretate the legislation and guidelines that are coming out, and he's been working with our community partners to make sure that there is a good translation of that information coming through. I'm just going to go into a full screen mode. Okay, so we'll get started. Before I get into some of the public health measures, I just wanted to share with you in terms of where we're at with we did issue a COVID alert last week. We are beginning to see an increase in the number of cases within Simcoe Muskoka, and it is quite concerning for us. For last week, we did see 55 confirmed cases of COVID-19 within Simcoe Muskoka, and this was the highest number of confirmed cases within a 1-week period since the earliest stages of COVID for the pandemic, so the second highest week. The highest was back in a week of May 3rd, and at which time we did have 74 cases. So we have noticed an increase over the last few weeks. With this, where we're totaling as of last week on September 16th, we had a total of 778 cases and 37 deaths within Simcoe, Muskoka. We are also seeing some changes in terms of where COVID is happening within our communities. For example, you can see here on this graph that in the earlier stages of COVID, just when we first started to deal with the pandemic, most of our outbreaks were in the yellow zone, which was the institutional outbreaks, more in long-term care facilities and rest and retirement homes. And then as things began to reopen, we saw a shifting. There was additional control measures and more stringent measures that were taking place within institutions. But as businesses and workplaces and services began to open, we started to see some of the cases and outbreaks occurring within the workplaces. And we had a few sporadic cases and incidents within long-term care facilities. One thing that we are noticing recently is a significant change in terms of where we're seeing outbreaks happening. So most recently, there was a high number of community clusters within Simcoe, Muskoka, and we're seeing that most of these outbreaks are happening within the household settings, where we're seeing clusters within families, with family and friends. And we're attributing that to people becoming more relaxed with their social circles, and they're getting together with friends and family. There's not as many precautions or as many measures within the home setting. And so we're seeing a lot of transmission within those settings. We did have some questions that were presented in terms of projection and models. I just wanted to share this screen, and I will be sharing the presentation as well. If anyone is looking for information in terms of our current cases, looking at how many tests we're getting done and our positivity rate being the number of positive cases in comparison to the population that's actually getting tested, then you can take a look at our health stats page. And this will also show and provide epidemiological curves by municipality to show which areas we're starting to see or have been seeing outbreaks and positive cases within Simcoe, Muskoka. And it also provides trajectories and forecast modeling in there, and it gives you some kind of idea in terms of the next few weeks of what we expect to see. Do keep in mind that we can't forecast too far ahead because a lot of what will happen in the future really depends on everyone here, as well as our community, our institutions, and our businesses, as how well we implement public health measures, how conservative we're being in terms of our practices, and how many precautions we're taking in order to prevent the spread of COVID-19. I will just do a quick click on here just so you can get an idea of what you would see at our health unit webpage. Hopefully it'll come up. So in here, you can see that it provides highlights. So we do update this on a weekly basis, and it runs from Monday to Friday, and it gives you the number of confirmed cases. We are a couple of days behind, and I did mention in terms of the transition happening more into the community. We are also seeing a shift in terms of the populations that are being impacted. Right now, we're finding in younger adults between 18 and 34 are the highest rate of infection since June. In the earlier stages, we did see that a lot of the elderly population did have COVID and were acquiring it. So we're seeing a shift there as well. It does go into the number of deaths, and down here you can see if you are looking into trajectories, it gives a number of graphs and information in those, and also you can click in to see where the different outbreaks are within the community as well. So there's a lot of information that you can obtain by visiting our website. Another thing that I just wanted to point out for the group is that we do have community partner and healthcare service provider updates, and they are available on our website. And so if you want to see the information that's going out to our community partners, we post them on our partner updates. And this provides a lot of very good information around our current situation, gives total numbers, gives some highlights for the last week or two, where we are in comparison to the province. And you'll see a number of highlights and trends throughout. And often there's really good links in these resources as well. It gives updates in terms of what's happening within our communities. One of the biggest areas that we're looking at right now is around social circles. As I mentioned that with social circles, we are seeing a lot of increase in terms of cases within household settings. So that I will be focusing on that a little bit further in the presentation. There were some questions also in terms of preventing a second wave. With this, we are starting to see significant increase in the last few weeks. We're closely monitoring the situation. A lot of it will depend on our local epidemiology in terms of our different incidents and where it's happening and how our public health measures. And the most important thing when we're looking at preventing a second wave is we want to make sure that we're working collectively within the community, within all of our different settings within Simcoe, Muskoka. And some of the things that we would want to make sure that we have in terms of the primary areas that we can really control and contain COVID is through physical distancing. It's probably the most significant public health measure in terms of making sure you're keeping away from other public so that there cannot be that transmission of COVID. Another area that we're really focusing on is testing and tracing. It's really important that when there are cases, if people are ill, that they're tested and that we're able to identify anyone who's positive with COVID so that we're able to prevent an outbreak by interviewing them and seeing who their contacts were and making sure that they're quarantining or isolating themselves. We know that by these two activities alone, it can have a significant impact on our healthcare system and really help to slow the spread of COVID. And that will help our hospitalizations in terms of keeping the numbers down for ICU cases and protect our healthcare system as a whole. Just with this messaging, I will be going into many other different areas of public health measures that we can take to help prevent a second wave or control it. Those we'll be covering through this presentation. So in terms of Simcoe, Muskoka, we're currently in stage 3. I have a link there for the framework for opening the province. And with this, you will see that it really is a regional approach. You'll see certain areas within the province that they're in phase 2 still. Most health units are in phase 3. And the movement between these phases, it could be going back and forth at any point in time, but that decision is ultimately at the direction of the province, and it's done in consultation with public health officials. So as our health unit, we will be monitoring in terms of how the virus is spreading within our community, how well we're containing it, what type of public health measures are being put in place. We have public health indicators, and we're looking at trends analysis on an ongoing basis. And depending on what we're seeing in our community, our medical officer of health, Dr. Gardner, would make recommendations up to the province to recommend whether or not we would move between these phases, or there are other measures that we can also implement locally. So you will see that locally with our own medical officer of health and some of our municipalities and bylaw offices, we are able to implement additional localized measures and requirements through directions or orders in order to ensure that we're containing COVID within our communities. Martin, I just wanted to sort of put it over to you in terms of, I know that you do meet with some of our municipal partners. Would you be able to advise in terms of some of the discussions that maybe happen with some of our community partners and some of the measures that they're looking at?
Certainly, Kelly. Can everybody hear me? Can you hear me, Kelly?
Yeah.
Okay, great. So one of the things that I always tell people who call in with the different proposals is that there's 3 layers. The first layer is the provincial regulation, the stage 3 regulation. It's the law. There's also the local health unit requirements, which is Dr. Gardner's masking requirement, which is the best example of a health unit requirement. And then at the municipal level, there's going to be bylaw and local policy. So put those 3 items into your framework as a business person when you're considering what the rules are. There's the provincial, then there's our health unit, and then there's the at the municipal level, there could be bylaws such as in Barrie and Aurelia for physical distancing. But you're not alone in making any of these determinations. A quick call to the health unit, to our health connection line, as Kelly has illustrated, can help you answer all of these questions. If anything, today's presentation is a health promotion, is our promotion for our health connection line, which can give you the answers, all of the answers you need in terms of these types of precautions. Thank you, Kelly.
Thank you, Martin. Okay, and then just in terms of the instructions that Martin was referring, and myself were referring to, I do have links to in the presentation. They do bring you to the instructions for businesses, and in there, these instructions are enforceable instructions that were put out by the Medical Officer of Health that require businesses to have policies in place in order to ensure that people are masking as they come into their facility. There's requirements in terms of making sure you have effective measures for physical distancing, and then in terms of promoting hand hygiene and hygiene practices such as cough and sneeze etiquette. So I'm wanting to see some promotion there. So in terms of the health unit, we do have officers, provincial offenses officers, and we are able to enforce if we do receive a number of complaints within a particular facility. We would do an investigation, and if we're finding that people are not, or businesses are not following our instructions, we can take enforcement action if needed. But we do overall try to work with our businesses and educate them. And I can say, just looking at, in terms of containing the spread, you can see from that previous graph that really we are doing a great job here locally within Simcoe, Muskoka, and we're not seeing many outbreaks in workplace or institutional settings. So just moving into that sort of the community spread and within the household setting, you may have recently heard that the Premier has now made some amendments to Ontario Regulation 36420 in terms of the rules for stage 3. And within that, there is requirements for social gatherings, and these are for private social gatherings across the entire province. So I put a link there to the legislative changes, and you will find the requirements in the actual regulations, and these are in the stage 3 components. So you would just have to, it's a fairly long, and this also does outline, and Martin can perhaps refer to these as well in terms of some of the general requirements for businesses later in the presentation. But in terms of the social distancing component, it's at the very, very bottom because it's one of the newer components, and it does speak to the requirements. I'll just summarize them in the next slide. So what we are asking locally as well as at the provincial level is to limit your local social circles. So in terms of staffing within your businesses, really trying to educate, and because we know that these types of outbreaks are happening within the household. We don't want the household members to start to bring COVID into the workplace or into institutions or into the community. So it's really important that for employees within businesses that they are following these same type of precautions within their homes. So we are asking that people shrink their close contacts to people in their immediate households, and only come in close contact, such as hugging and touching people with those immediate household members. And if they are going to have people within their homes, to limit it to 10 people or less inside and 25 or less outdoors. And also if it's anybody outside their immediate household members, to really practice physical distancing, wearing a mask even in public places or outdoors if you cannot physical distance. So really looking at some of those parameters and requirements that businesses and institutions have had to implement within their own settings. We're asking for people to do some of those practices within their home as well. What does it mean in terms of stage 3 for you as a business? It means nearly all businesses and workplaces can open, but they have to operate with proper public health and safety guidelines. And there are some high-risk venues that continue to not be able to open. They must remain closed, and some activities that must remain closed. We do have, as I mentioned, in terms of the regulation 36420, which sets out the rules areas in stage 3. Martin, I don't know if you want to go into any of these details. Is that something that you want to go high level, or did you want me to go into this link?
No, what we'll do is we'll take a quick look at the sector specific guidelines, which show the rules, as it were, for different sectors, so that you know, you as a workplace operator, what your sector is and what the rules and recommendations are for that. This link is really good because it has posters for your workplace, specific tips for the type of business you have. So have a hard look at this page, which is embedded within the presentation. There's PPE suppliers information as well. Everything you need as an employer or workplace operator to cover off your COVID-19 precautions as recommended by the province. But again, do not hesitate to call into the Simcoe Muskoka Health Connection line. They will refer you to this page, but any more further questions you have, they can answer specific to your scenario.
Thank you, Martin. So I pulled that up high level. We will not be going into the sector specific guidelines. The purpose for today, we are going to be going into some general public health measures, and that would be more applicable to every workplace. But if you're looking for specific guidelines and requirements for your type of business, I would highly recommend that you do go into those links and take a look to see in terms of, and also the legislation, because that will give you some more guidance that's very specific to your particular sector. And as Martin mentioned earlier, you're more than welcome to call the health unit. We're here to help and assist you along the way as you begin to reopen, or if you have any concerns in terms of health and safety or operational requirements within your setting. One of the other areas that I really did want to point out for this group is at the provincial website, there are tools there that can really help you identify where the risks are within your own facilities. They ask a number of questions that really start to think about those key areas where you could implement measures to help control the spread of COVID. So it does ask a number of questions. And then based on the information that, or the assessment that you're doing, there's a list of risk mitigation measures that you can take within your workplace. So I'm not going to go into these links, but I have provided in the slide deck, and that is available for businesses to take a look at as well. So gathering limits businesses in the community. So in the legislation, there are some requirements that speak to gathering limits. Martin, did you want to cover this area?
Sure, I can start with this one. In broad strokes, as a business, you can have in your business as many people as can safely fit with that 2-meter distancing in mind. There are some settings that are limited to 50 indoors. So rec centers, aspects of rec centers have limits of 50 in a weight room or based on the 2-meter distancing. If you've got a very large business, then you can accommodate your employee safely, again, spacing people at 2 meters apart. The new stuff that came in on the weekend from Premier Ford speaks to basically like unorganized, unmonitored private settings. So for the most part, not too much to do with a business. There was a question I saw in the side column about the Santa Claus Day Parade, and that would be a good one to follow up with us, Bill, and with New Tecumseh directly. My sense is that probably would be out of scope because of Premier Ford's announcement on Saturday, because of the limit to 25 for the type of gathering which is unmonitored. But in terms of your businesses, take a hard look at the space in the space within your organization, within your buildings. If you have any questions, call the health unit and we can discuss the physical distancing aspects, perhaps masking, and other types of barriers that might need to be created inside. At this point, it's September 21st. If things have been working well inside and also with your employees working remotely too potentially, then you're likely in a good situation. But as Kelly said, if you looked at the tools that the province has provided and you're a little concerned as to some of the risks, then do follow up with us through the Health Connection portal, and we can support your questions as to a safer workspace. You don't have to determine these criteria by yourself. We're here to help you. We can't just do it on this call, but we can definitely do it with our staff who are trained to support you and have all the information. Is there anything further, Kelly, that you wanted me to speak to you about this?
Well, on the next slide, there was another question dealing with the trade show that's coming up in 2021. So they were asking around restrictions, if they've been lifted, if best practices. So I just really wanted to highlight in terms of the health unit, we're really discouraging any type of large mass gathering events that bring large number of peoples together. And we don't actually go through and approve events. We try to help guide agencies and businesses through the requirements and looking at what kind of public health measures. So we wouldn't advocate or say we're approving certain events. And I don't know, Martin, if you want to add anything there in terms of approval processes. We really tried to point out what the legislative, we use the Ontario regulations and the Emergency Management Civil Protection Act, any of the provincial guidance documents and tools. And we also look at our localized epidemiology to really try help guide us in terms of what we would permit, and we will take measures to ensure that there isn't a spread if needed. So we don't per se approve processes, but we can definitely help in terms of guide you through and discuss what viable options there may be or may not be. So I don't know if there's anything else that you wanted to add there, Mark.
I will say that each of the municipalities where your business is as equally important a person to connect with, and they'll refer your request to us as well. But it's a three-part conversation because the municipality is ultimately in the driver's seat as to these things, and we can say, well, it looks like this can work or this can't work to our municipal partners. That's why when it comes to the Santa Claus Day Parade question, we would assess that with new Tecumseh as well. We want to make sure that that everybody has all the information they need to remain legally compliant. But we're not really approving, doing a pre-approval on anything, return to play documentation or openings of businesses. As long as you're compliant with the legislation, then we can help you make that compliance assessment.
That's right. And the other factor that we do have to take into place is things change so often. Like you wouldn't even, a few weeks ago, everything looked so promising. And now all of a sudden, the last 3 weeks have been a sudden rise and a sudden surge in number of COVID-19 cases within our communities. And so really the public health measures and restrictions or requirements are so based on the epidemiology and the issues or concerns that are happening at that point in time. So may not have thought that we would have had restrictions or requirements in a private setting at the onset of the pandemic, but here we are in September where they're opening the legislation and making regulatory requirements for the public in homes. So we just don't know what's coming, and it all depends on the trends.
I do appreciate too that people can be frustrated with the rules, with the changing rules, etc. But I do want to note that it's working. That in Simcoe, Muskoka, this because of the social compact that we've all been pulling together, it's really working, and we've all got each other's backs. So thank you as well for participating in this call, because it demonstrates your commitment to keeping yourself safe, your staff safe, and members of the public who come into your businesses.
Thank you, Martin. And I do want to reiterate that in terms of where we're at in comparison to the rest of the province, we are doing very well, and it is a result of the efforts being done by our community as a whole. So just in terms of some general messaging, this is more intended for your staff or your clients. The public health measures, these are very standard. You've probably seen them all over the place. Stay home if you're ill, keeping apart 2 meters apart from people outside of your immediate household or social circle. And if you are worried that you've contracted COVID-19, you know, just encouraging staff to get tested if they are really concerned. Our assessment centers, we're very fortunate to have a number of them within Simcoe, Muskoka, and so there is availability of testing locally. Reinforcing cough etiquette and hand hygiene, and also wearing a face covering where physical distancing is a challenge or not possible. And then, of course, in terms of environmental cleaning and a reminder around travel, we are discouraging international travel, but if it must be done, then there is a self-isolation requirement for 14 days after return home. And if at all possible, working from home. So in terms of an employer, there are different ways that you can help your employees and your workplace stay safe. So offering remote access work from home, I'm trying to have use technology to have meetings remotely if possible, setting up those hand wash stations, providing hand sanitizer, and opportunities for proper hand hygiene throughout your facility. Again, in terms of some of the 2 meter apart physical distancing, this would be applicable to staff and patrons and customers, really wanting to make sure that you have signage up, and then if you need to, you know, just redesign or change the setup within your own facility for staff so that it does allow them to have that physical distancing. If that physical distancing isn't possible, then barriers such as plexiglass can be used. And you can also control number of people coming within your facility, and using separate entrances and exits and different decals. As Martin mentioned, there are tools, resources, posters available on the provincial website to help you get started, or if you don't have those in place, you can use those, and you can use them and apply them within your own setting. And then, of course, PPE and mask use when you're not able to physically distance. Just in terms of the staff and client intercept. So when your staff are dealing with the public, just trying to limit the number of customers that your employees would have close contact with. So also even between staff as well. So you might want to schedule fewer appointments or limit the number of patrons coming into your workplace at one time. And then also, if you are having anyone come into your facility, if at all possible, I know the bigger workplaces it might not be as possible, but in the smaller settings, if you can, try to document as much information in terms of potential contacts, in particular where there is contact with staff members. In case someone is confirmed as positive for COVID, it does really help us to have that list of information available to us with contact information so that we can get in touch with those contacts and control the spread quickly. I've already mentioned in terms of trying to avoid or reduce the number of in-person meetings, and if you do have social distancing in place. And then in terms of workplaces that are accessible to the public, just making sure you're using the signs or the posters that are available on the provincial government website. There was a question that was related to the number of people allowed into business at one time. This is kind of a complex, it can depend on the type of business that you have, but in general, there is a calculation that you can use for people per square foot that could be used in terms of determining the square footage requirements per person. So I've included that in the slide deck here. And then, of course, there are in certain workplaces in terms of limitations or businesses where there might be limitations in numbers as a whole. Martin, was there anything that you needed to add there in terms of that question?
No, I do note that there's questions in the sidebar, but we will come to those during our Q&A session.
Okay, perfect. Okay, and then in terms of for staff themselves in your workplace, you know, work from home if that's possible. Again, flexible work hours, so that will, you know, you don't have as many people in the office. Oh, did you guys lose my?
It's good, Kelly. We can see the still see your presentation.
Okay, perfect. I wasn't sure what happened there. So if you're doing flexible work hours or different shifts within the business, it then reduces the number of people within your workplace, and it does allow for more social or physical distancing and more space available for the staff that do need to come into the office. And we are recommending that you continue to implement these practices until a vaccine is actually available, because it will be some time before we are able to acquire immunity or protection at a community level. If you're a very large workplace, some of the other strategies that we recommend is cohorting or bubbling. So we would recommend that grouping staff together, so that if you do have an outbreak within your own business, that you're not potentially wiping out your entire workforce. So at least then, if staff are continually working with the same staff members, if they're spread between staff members, it is very much contained, and then it won't you know, destroy your business operations. And also just things in terms of having business continuity plans, health and safety plans in place as well. And that's really important. Expect that you may have some work absenteeism, and just really looking at what your essential services are. And then if you're ever dealing with press conferences or meetings, to try to do those remotely using technology if at all possible, because we're trying not to get people to come together as a group or in large gatherings. So in terms of the environment, we have some links in terms of different cleaning and disinfectant agents. So I won't open that up, but just if you're wondering in terms of what products are good or effective against the virus. So that link is a good resource to check out. And we also have, in terms of the cleaning disinfection schedules, just making sure that you're doing a minimum of twice daily for some of those really high touch surfaces, such as keyboards, electronics, you know, doorknobs, those types of things. And there are a really good resource in terms of guidance document that's available at Public Health Ontario's website that I've linked here as well. It's important that if the staff are involved with the cleaning, that they're provided with appropriate PPE for use when handling the products, and also that you have proper ventilation for when using chemicals. So I'm just going to go into face coverings and masks. I know there were a lot of questions that were asked in terms of masks, so I've tried to answer as many as possible. So specifically asked about the rules or laws that are set out by the Ontario government or the Ministry of Labour about face masks or face coverings in the workplace. I understand that there is a session coming up on Wednesday that's free, and participants can register for it. So perhaps that's something that you may be interested in terms of Ministry of Labour, and Carol could maybe provide a little bit more information after this presentation on that session that's upcoming. But in terms of general rules, so there are very strong recommendations at the provincial level in terms of from the Ontario government. However, locally, we have our medical officer of health, Dr. Gardner, did send out an instruction letter to local businesses, which makes it enforceable for mandatory face coverings, indoor public. So it's more to have policies in place. So we want to see that businesses are putting the best efforts in place to ensure that the public coming into their settings are actually wearing, and they're going through a process to ensure that their efforts to make sure that people coming into public areas of businesses are wearing face coverings. So we're asking that they have policies in place, and then any staff that are working within the businesses in the public serving areas or receiving areas also wear masks or face coverings. And there are some businesses that are exempt. And also in terms of, and not all customers are also required to wear face coverings or masks. So there are certain exemptions, medical exemptions that will allow, or other exemptions that will allow for individuals not to wear a face covering. So I know there's a lot of questions coming through, so we'll hopefully be able to answer and have some discussion at the end. And you may see there are a number of questions and answers here as well through the slide deck. So if I do touch on those, hopefully I can, I can't see the questions coming up, but I can see things popping up. So hopefully we'll be able to answer some of them as we go through. There was also a question in terms of mask myths. And so I thought, well, maybe it's easier for me to say what the mask facts are. So in terms of wearing some of the items that I thought of, we're wearing a face covering or mask when you're sick. It really is intended to protect the people around you. And when other people wear a face mask, they're actually protecting you as well. So it's not so much the wearer, it's the person around you. And then this statement here, face coverings will not protect you from getting COVID-19. This does link to our provincial website, and it does go through and identify just in terms of what you can do or what other activities you should be doing to make sure that you're not getting COVID-19. So there is information on here, and it does stress that it's not so much about protecting, it's more about protecting others. And some of those other measures in terms of the social distancing, the hand hygiene, just in terms of environmental cleaning, those types of things are other areas that you should really focus on in order to ensure that you are not going to acquire. Okay, and then why masks if you're not sick? Well, in general, we know that COVID-19 can be transmitted and spread before symptoms actually start. So people might be carrying the virus and not even know it. And there is a potential that it could be transmitted before those symptoms begin. And then in terms of the cloth and non-medical masks, they're recommended when physical distancing cannot be maintained. However, we don't want to assume that our goal is that we still maintain that physical distancing, so it shouldn't replace physical distancing requirements. So even though you're wearing a mask, you really want your customers to maintain that 2-meter distance between each other as well. Martin had mentioned in terms of the workplace PPE supplier directory, which is available on the provincial website, and I put a link in there as well. Another question was, what type of cloth mask should associates avoid using? So in general, if you're not a frontline healthcare service provider or worker, or you're not working with high-risk populations, medical masks should not be used to avoid shortages of personal protective equipment in frontline healthcare providers. Face coverings are not considered PPE. Medical masks are. So we want to make sure that those are reserved for individuals that are working with those high-risk populations. In terms of face coverings, it's really, it can be something as simple as a bandana or scarf, cloth mask, and it can be purchased or made. There is something known as a mingle mask that does not meet the criteria of the recommendations for face coverings. And there's been some questions in terms of face shields. And so our messaging is that face shields, they do not replace face coverings or masks because your nose, mouth, and chin must all be covered, and face shields only protect the wearer from respiratory droplets and don't protect the people around them. So we're asking that face masks be worn. However, for those individuals that might have medical issues and aren't able to wear face coverings, face shields may be beneficial for those individuals. It's better than nothing as an alternate means of protection. There was a lot of questions about preventing glasses from fogging up. And so I have a link here. This information is available on our website. It comes from the Royal College of Surgeons in England. And there's just some steps here. So I'm not going to get into these details, but I just wanted to point out that we do have this information available on our website. And these are kind of the steps that you would take to avoid that. I know there's a lot of questions around fogging masking and fogging of glasses. So concerns there, and how do you prevent that? So we do have some information available. Also, there were some questions about plexiglass and barriers. So the National Collaborating Center for Environmental Health has an excellent resource that outlines more specific guidelines. There's a link that does go into sort of some of the dimensions, the requirements. Again, I won't go into too much detail there, but I did want to share the link. So that's something that we will share the presentation so you can access that information. Okay, I'm going to go quickly into screening. So when screening should be done, and also the results of screening. So some of the areas for screening, there's different types. So one is the patron screening for illness. So we recommend that they do self-screening at the entrance coming into your business. There is signage that's available that you can post. That's available at the Provincial website, and we do have links from our website. In terms of the businesses themselves, we really are encouraging them to do active screening for staff. That means active screening, that they're doing screening before coming to the workplace every day, and that they're active, meaning they are providing you with the results. They're reporting the results to you so you're aware. And also with the screening, we're trying to keep control or track who's coming into work so that you know who's been potentially in contact with others within your workplace. If you have a self-screen for COVID, if they have the symptoms, I've got some links in terms of what are considered symptoms, and there's also the provincial screening tool. So in the screening tool itself, it does look at if the staff member would have new symptoms, if they traveled outside Canada in the last 14 days, and they ask questions around whether or not they've had any close physical contact with someone in the last 14 days that's either tested positive, who's sick, or who's returned from Canada within the last 14 days.
Ellie,
So,
I'll just jump on this one quickly too. This is a recommendation. It would be wonderful if you can do the active screening the day of screening. The provincial criteria can change. So if you've got an HR lead or occupational health and safety person to look at that occasionally to make sure those are up to date. And then the retention period for those records is based on the requirement for restaurants is a month. We think it's fair to ask for you to retain those records for a month, recognizing that paperwork does pile up. So that will give, if there was a problem, somebody tested positive in your workplace, our COVID-19 team can connect with you and see who is working on such a day based on your record retention of about a month.
I'm going to move along because I know that we're going. So I put some information of what to do when staff are sick. So there are, visiting a local assessment center. We have links to all the different assessment centers. If they are sick, they should be self-isolating for 14 days. They can come back to work after symptom be 24 hours if they test negative only. So you have to make sure if they are testing positive, then the health unit will be following up with them. It's really critical that if even staff have one symptom, that they do not come into work and they stay home, because you don't want to have spread to other employees. If they do test positive, of course, self-isolating, and the health unit will be following up in terms of case and contact management, and they will provide guidance in terms of when they can return to work. They also will be assessing for high-risk individuals or contacts. So if there are other individuals in your workplace, we will follow up with those high-risk contacts, and they would also need to, if they are positive, then they would need to self-isolate. In terms of what should they do for proper procedure, employees that do test positive, they really do need to let their employer know, and you should have your own internal policies and processes in terms of how to deal with a situation when a person tests positive in terms of control within your own workplace. Contacts with others who are ill. So really, as Martin mentioned, things change all the time. At this very point in time, if they're in contact with someone who's ill and they have tested positive and that person's tested positive, they need to self-isolate. If they come in contact with someone who's ill but they haven't been tested, or they weren't tested positive for COVID-19 and they're not considered a high risk, then right now the stance is to self-monitor for 14 days. If they're really concerned, they should be getting tested. But again, that's today. If you went to the screening tool at the provincial level and you're asked those questions, if you've been in touch with someone, contact with someone with COVID symptoms, they'll ask you, was it 2 days ago? Was it 14 days ago? Was it more than 14 days ago? And they will recommend that you get testing done. In terms of the provincial outbreak management strategy, there's a lot being done at the province. I'm not going to get too much into this, but I did want to point out that there is information available in terms of the app and Alert for Ontarians. So that's something that people can download on their phones. And just in terms of reporting outbreaks, there's requirements for reporting both to the health unit as well as the Ministry of Labor. So that if you do know that there is someone who's tested positive, there's reporting requirements. We will get those results in from the lab regardless, and we will be in touch with those who are tested positive and take outbreak management measures. With that, if part of our investigation for outbreak management, we could potentially conduct an on-site investigation within your facility. And in terms of the Ministry of Labor, they have a lot of information on their website in terms of the requirements, or you could perhaps participate in the presentation that's happening on Wednesday. I'm not going to go too much into what the public health unit does. I think I've covered this in terms of investigation. We do follow up in terms of clusters and outbreaks in the workplaces. We could go in to do a workplace inspection, and we could implement orders or directives in terms of managing the outbreak within your workplace, which are enforceable under the HPPA. And if needed, there may be a public health alert that may need to go out to notify other health units or the public at large if there's a risk to the community. In terms of you as an employer, you have responsibilities for reporting to the Ministry of Labor, and there is in terms of maintaining confidentiality for employees. Not going to get into too many of the other areas of cleaning, disinfecting. I think I've kind of been through some of those components, and but it's also important in terms of considering how you may want to communicate with staff or customers if there's an outbreak. Again, we are discouraging non-essential travel as a means for control. And if there is travel, there's requirements, which there's a link there if you need more information on that. In terms of impacts for the workplace, modification of policies, you can plan in terms of how you arrange your workplace. There was a question in terms of ventilation systems. In terms of ventilation systems, you should make sure that you have scheduled regular inspections and tune-ups by certified technicians, and ensuring the filters are replaced and scheduled to support proper operation. There was other questions that had come out in terms of viruses in the winter. And so this is from the World Health Organization. In terms of cold weather and snow, do not kill the coronavirus. And some best practices in terms of flu. What we're saying pretty well the same precautions as COVID for preventing flu. However, the main difference is we're recommending that you also get a flu shot. And there's a link there for information available on our website. And then Martin had mentioned in terms of us working with you in terms of compliance. If you're finding that you have difficulty with complying, there are the province is also willing to work with you, and you can put through proposals if you aren't able to meet the requirements in terms of submitting a plan. And so there's and I have here there was a question in terms of staying apprised and resources. I would recommend that the best places to look for resources are the Government of Ontario website, public health agencies, federal, provincial, or your local public health unit and your local municipalities. And I've got some key links there for you. And then links for financial. And just to end up, I just wanted to let everybody know and reiterate what Martin had indicated earlier. We're all in this together. We're doing a fantastic job locally. Our levels are lower than the provincial average, and this is because of everyone's efforts to date. You are making a difference. Stick with it. We expect this to happen, to be ongoing for quite some time until the vaccine's available, and really just managing your workplace carefully to control the spread of COVID-19 really will help to support and contain COVID. And we're here to help you when needed. And that's our presentation.
Thank you so much. We have a few minutes for some extra questions. We have about 5 minutes left, so maybe if there's just a couple that I can see here that that I could ask you. Are there any specific regulations around Airbnbs in Simcoe County?
It depends on the municipality. So the very first person to check with is if Airbnb is allowed use in the municipality. Check with your local planning department. But ostensibly, accommodation is allowed under the regulation. Check with your local municipality.
Okay, that's great. Somebody else has also asked if the same procedures would be consistent for employees as well as volunteers. In other words, are volunteers considered equal to employees?
Yes.
Okay, that was easy. Some concerns around children getting back to school. So in other words, if an employee's child has been in a classroom where another child has tested positive, or a teacher or what have you, but they're not showing any symptoms, what would the proper procedure be for the employee as the parent of that child in terms of going back to work or self-isolating?
So in terms of if there's a positive case within a school, the health unit will be in touch with any of the other contacts. So if another child in that school is a contact or a high-risk contact, the health unit will be in touch with the parents of that child. So the employee would know. Right now, as it stands, as I mentioned, things are constantly changing. If your own child is not got COVID and hasn't tested positive for COVID, then, and you're not showing any symptoms, as it stands at this point in time, you may work. As long as you're symptom free. If you are concerned about that you've acquired COVID, then definitely go and get tested.
Great. One business has asked if health officials will be available for on-site visits on request. So preventative, I suppose, really.
This is a tricky one. What we're doing right now is our efforts are to provide support to the public through our Health Connection line with public health inspectors. If there's a compliance problem, if the public is coming to us with complaints, we are following up those. But let's start with if you feel you wanted to review any of your reopening or layout or any of those types of business really individual scenarios, the best thing to do is to call Health Connection, and then a public health inspector can talk through with you your business layout and any of those concerns. And then if you're still not satisfied, then at that point, potentially an inspection could happen. But right now, our inspections are related to non-compliance problems primarily, because it is a difficult period.
And I can say that it's highly unlikely that we go out and do a visit to a facility. Most of our staff within the health unit have been redeployed for case and contact management. So a lot of our public health inspectors are redeployed to try to contain the outbreak. And we are barely getting to some of our, we have to really look at what our essential services are and making sure we continue on with those services. So to be able to assist, we can try to help as much as over the phone, but it's highly unlikely we'd actually go out to do an on-site assessment.
Just a question that's just come in says, receiving paperwork from the public, how long could a document be infectious? Do we know?
I'd have to ask our research analysts on that one. So perhaps we can bring that question back to the group in terms of how long the virus can survive. I know there is information available, but there's a lot of paper that's being spread. I think the most important messaging around that is hand hygiene, making sure that you're not rubbing your eyes or face, and wash your hands before you eat, and cough etiquette. Really, that's, you might be concerned about paper, but you're touching a doorknob or an elevator button or your car handle. So hand washing and hand hygiene is important.
But that's the type of question that you'll get a quick answer to from a Health Connection or Health Connection service too, depending on the different types of materials that are being handled, plastic folders, paper clips, those types of things. Do call in, ask those questions, and you'll get you'll get a clear answer depending on what you're dealing with.
Okay, that's great. Just one real quick one. Can a customer be refused access to a business if they're not wearing a mask?
So we're not requiring businesses to refuse people. We're asking businesses to have policies in place, and we're asking them to ask their customers to wear. We're not asking them to ask for medical records or any information to prove that they have a medical condition to say that they can't. However, businesses, I understand, can have their own policies or practices. And I don't know, Martin, if you have anything that you can add through that anyway.
Yeah, I mean, McDonald's, you know, had the no shoes, no shirt, no service. You as the proprietor, owner, operator can make your rules for the safe operation of your workspace. And you're advised, though, to consult with your HR person or with a lawyer as well, just to make sure that nobody's civil rights are being violated. But for the safety of you and your staff, it's a great question, and you should do everything you can to make sure that people are not at risk of spreading this terrible virus.
Great. So there's been so much fantastic information presented here this afternoon. I think we're going to wrap it up just because we're at 4 o'clock, and I'm sure people have maybe other questions that they would like to look into. I did want to refer to what Kelly was saying. The CDC, which is our organization, does have a workshop coming up on Wednesday. It's from 10 till 11. It's free. And we are featuring presenters from Workplace Safety and Prevention Services, WSIB, and also Health and Safety Inspector of Ministry of Labor Training and Skills Development. So I would encourage you to go to our website, reallycdc.com, and register for that workshop, and maybe there's more questions that we can answer. But again, I just want to thank our 2 experts very, very much. We are going to be sending a survey by email along with the recording of this session. So please watch for that and let us know what you think. If you're interested in hearing from more experts, information on the series can be found at simcoe.ca/ask an expert. And thanks again to all our partners. Wish everyone a wonderful and safe day.
Thank you.